Hello and welcome inside the training room. I am your host, Dr. Ken Kaufman, and I am absolutely pumped to have you here where you get exclusive, behind-the-scenes, VIP access into the training rooms of professional sports. Hello and welcome back inside the training room and for my informative interview with the laser guy, Jeff Gavette. In this episode, Jeff discusses the physical effects of photobiomodulation that results from laser therapy. He also discusses the various conditions treated with Class 4 laser therapy and the basic protocols for each type of injury. Let me back up a little bit and talk about how does photobiomodulation actually work? What is the chemical, the biochemical reaction of the body when you're using infrared light?
Yeah, it's just the absorption of light. To make it the easiest, that I always tell everybody all the time is everybody knows photosynthesis. Mm-hmm. If you made it to third grade, you know how every single plant outside.
It was a long time ago, my friend.
Me too. Yeah. But every single plant outside absorbs light. Mm-hmm. They absorb light for the same reason, for energy, in order to have life. Mm-hmm. So without the absorption of light, that plant is going to die.
Right.
In the human body, what's really unique is that we're using the exact same absorption of light, only we're using it to heal. Mm-hmm. So if you can take a scenario like, pretty much anything that it's going to absorb through the chromophores. Mm-hmm. We're specifically targeting the mitochondria.
Right.
The absorption property is very well shown between 600 nanometers and, roughly 1100 nanometers. Mm-hmm. All of them are going to give you a little bit of different absorption properties and a little bit of a different characteristic as far as the outcome. Mm-hmm. That's why understanding and knowing why you're doing what you're doing and how you're doing it. But ultimately, it's the same thing. It's the absorption of light. Mm-hmm. It's just going to speed up the production of ATP. So it's going to balance the cell out so that it can produce ATP, adenosine triphosphate, which is the fuel that cell needs in order to restore or heal itself.
Okay, right. So, and then there's a couple other properties that, as far as, so for example, a local site release of nitrous oxide, which is a vasodilator, helps open up the microcapillaries to be able to bring more oxygenated blood. So in addition to the extra fuel in the ATP, you also have, extra oxygenated blood being able to come to the area and, help, bring healing properties to that damaged tissue as well.
Yeah, there's definitely a lot of different other cascading effects that occur once we get the proper absorption. Mm-hmm. What I always just say is that we've got to get the proper absorption to get that immediate response. And then from there, the cell starts using that energy because it's designed specifically to heal itself. So all we're doing is giving it the fuel source, but increased oxygenation, blood flow, all your stimulants in order to start that healing process.
Right, exactly. Yeah. Okay. So, what kind of treatment or conditions, have you found? I mean, I know I utilize it for, we already mentioned shoulder or lateral epicondylitis or tennis elbow, or, muscle injuries and stuff like that. I use it a lot on, if somebody's got Achilles tendonitis or they have, I always say just kind of any itis
right.
is it's helpful with. So what other types of conditions primarily for the Class 4 lasers specifically?
Yeah, and I always just say Class 3 or Class 4, the absorption is the same. Mm-hmm. So we're using the exact same light. They just are not using as much power.
Right.
But the reality is it's FDA cleared for pain, inflammation, muscle spasms, and all of your itises. Mm-hmm. Or I like to say all of your itises because we're going to treat plantar fasciitis or any epicondylitis. It doesn't matter what we're treating. But that's the basis of it. So when somebody says to me, what can we treat? Anything that involves pain, inflammation, muscle spasms, and any of your itises. Mm-hmm. I've seen amazing things with even, trigeminal neuralgia, TMJ, Bell's palsy, sinuses, wound healing. there's a lot of different things, as long as we stay in the category of saying pain, inflammation,
Right.
muscle spasms, and all of your itises.
Mm-hmm.
But plantar fasciitis, it's a very tough thing to
Yeah.
treat.
Yeah.
But you can get an immediate response.
Mm-hmm.
And if they do a couple of treatments, I mean, they can have a really, really quick healing, as long as it's used in conjunction with some of the other tools that people
Right,
are using. But it's a great tool. It's the only tool that I know of that is at the clinician's disposal that gives immediate decrease in pain and increased range of motion.
Yeah.
Which just allows them to be able to do more faster.
Yeah, exactly. Yeah, the I've used laser very effectively for patients who have migraine headaches.
Yes.
Just put it on lower power. They have the glasses on, and then we just kind of easily go over, and almost instantaneously they feel better. It gives them a little relief, and I've fortunately never had migraine headaches, but I've seen patients that have migraine headaches, and that's they're in agony. So that's tough. So I know that I always tell my patients, we treat 4, and if you don't notice any improvement, we don't treat anymore. Because usually within 4 treatments, and sometimes even even 1 or 2, patients usually have some pretty significant improvement. What is there so for example, my most common thing are shoulder injuries, tendonitis in the shoulder. How many treatments typically on average do you think? And this all depends on the chronicity of the problem, if it's acute, if it's concomitant tears or whatever. But what do you generally see is the most effective?
Yeah, per the technique now that we teach, if they don't have a response within 2 treatments, they're immediately on the phone with us and discussing the situation. Okay, what are we dealing with? What are the MRIs or CAT scans or X-rays? What are we really looking at? Because they should have, if laser is done properly, there should be an immediate benefit.
Okay.
So are they staying to the 3x5? Are we treating, what wattage are we using? What wavelengths are we using? Are we blending them properly? But they should have an immediate benefit. Now, like what you talked about, if it's a tear, which is definitely research to show that it will help heal a tear, how far along are we? What are they doing outside of? Are they actually monitoring themselves to not cause the injury to go further while we're just doing this little rehab stint? But normally it's a 2-week process, maybe 3 weeks maximum, where they should have improvement with every single treatment. So they should have decreased pain, increased range of motion, and that should get better and last longer with each treatment.
Yeah, and it is. And in fact, I have a patient, and it just so happened she had an MRI before she came to see me, and she had a 50% tear in her supraspinatus muscle belly.
Okay.
And then she came into me. She didn't want to have surgery. She was freaked out about surgery. And so we did like a protocol of 5 laser treatments. And then my acupuncturist, he does prolotherapy. So he did, I think it was 3 sessions of prolotherapy spaced 2 weeks apart. Yep. And then she came in for another 5 laser treatments. And I was using rock tape, kinesio tape to give her some shoulder support and whatnot. And then she started a shoulder rehab program, and she was on that rehab program, I think it was 12 weeks, and then she signed up for another because she was getting stronger and noticing improvement. Well, then she just continued working out. I wasn't doing any more treatment on her, but she was working out. She ended up going back in. It was about a year after her original MRI, and she had another MRI to just kind of see where it was. And right in the report, and I'll pull the report up and have that little blurb on this episode. But it basically said, new collagen fibers laid down in the old injury, and it was in the process of healing up, like literally healing, not just it felt better, it was actually healed up. So it's extremely powerful technology, and I love it. So. Tell me about the new thing you're doing, the therapy bed, the light therapy bed, Theralite.
Right. Yeah, the product is called Theralite, Theralite.com. We have 2 beds. One's a fit, the other one's a 360. It's just going to be depending on the patient size, right? So the 360 can fit patients up to 7 foot tall, 550 pounds. The fit bed is made more for your everyday use, 6'4" and shorter, 300 pounds and less.
Okay.
So it's going to fit a majority of the people. But what it's doing is, instead of using laser, which is light amplification by stimulated emissions of radiation, it's using LED, which is light emitting diodes.
Okay.
Both of them cause photobiomodulation.
Okay.
The difference is that laser does have some contraindications or some precautions that you just have to be aware of. There's still not a lot, which is the reason why it can be used pretty regularly.
Right.
But LED doesn't have any
Okay.
contraindications or precautions that slow you down. You don't even have the same requirements for the eyes.
Oh, okay.
Because there's definitely, with class 4, you have more potential eye damage. So you have to make sure that the patients are wearing goggles and that you're in a room. With the Theralite, using the 4 different wavelengths of LED, it gives you way more versatility. And you're treating the whole entire body. That's why we call it the full body recovery system.
Right.
Because you're treating the whole body in 10 minutes.
No, that's awesome. So how long you been with them?
We launched October of 2018.
Okay, so just all right, so just a little over year and a half, something like that.
Yeah.
So how is it going?
It's been absolutely amazing.
Yeah.
It's been it's what I knew it would be, because there's a lot of offices that don't have somebody that they can train, that can do laser therapy, and they have to be in a room and locked up in a room and actually doing the treatments. The bed allows the patient to be able to just come in, get on the bed, and immediately get off. And then getting that photobiomodulation or that stimulation throughout their whole body.
Right. So it's unattended.
It's completely unattended.
Yeah.
So it makes it really nice because it's controlled through the front desk. So the patient just goes in the room. As soon as they're on the bed, they just ring the bell, and then it's started at the front desk.
Oh, nice. Okay.
Yeah.
So
it makes it really nice because the patient because you definitely want to be as close to naked as possible. Any clothing is going to stop the absorption of light, because it's not like laser. Well, even laser, you can't treat through clothing.
Right. Yeah.
So with the LED, it's the same thing. You're going to just get more shallow depth of tissue versus an laser is going to get more greater depth of tissue. So I like to just say, hey, if I have a plantar fasciitis that I need to treat right this minute and I need to have an immediate outcome, then of course I'm going to jump to the laser.
Yeah.
If I have something where they can come in and they can get treatments, they're going to get the therapeutic benefit over just coming in and jumping on the bed.
Sure. So I imagine that would be highly beneficial for post-exercise recovery.
Yeah.
The TheraBed?
What makes it nice about the Theralite is that it's for pain, inflammation, muscle spasms, and all of your itises, just like the laser, because it's causing photobiomodulation. But it also is working really well with sleep, skin, mood, and performance. So you can take an athlete, they can actually go work out, they can jump on the bed. It's going to speed up that lactic acid, right? It's going to get it out of the body so that they can perform the next day just as strong as before they did the workout.
Yeah, that's awesome. That's awesome.
Yeah.
So what's next? You're just going to keep kind of blasting through and learning more about laser, or?
Yeah, I mean, we're continuing to evolve. I was literally on an 1.5-hour phone call today just talking about different applications and how we can move it forward. You saw my bed in Panama City. So I have a mobile treatment room now that I take the bed to clinicians that are interested in, hey, let me see it. Let me have some of my patients jump on it so that they can be exposed to it. So I run around with the laser and with the bed, just treating people. And there's so many different clinicians that have never been exposed to a whole body photobiomodulation or even laser therapy still, because it's still a growing market.
Yeah.
So we just run around and treat all day and just let it be what it is.
Yeah. Awesome. Well, Jeff, I want to thank you for coming on Inside the Training Room. This has been fun. I figured it would be because you're a wealth of knowledge when it comes to photobiomodulation and light therapy, and I want to thank you for coming on the show.
Yeah, thank you so much for having me, and hopefully we'll be able to do it again.
Awesome. Cool.
All right.
See you again soon.
Thank you.
All right. Thank you for tuning into this episode of Inside the Training Room. For more information on Aspen lasers and Theralite, make sure to reach out to Jeff by sending a quick email to jeffgavette@gmail.com. And before you go, check out this clip of the Theralite full body laser bed.